Welcome to the Pawsome Companion, where pets are part of our family. I'm your host, Johanna Herrera, the founder of Coco and Bone Diet. I'm very excited to interview experts and pet owners to share their stories and insights so you can use them to take care of your babies. Hello everyone, we got today here Karen Potterton.
Yes.
Is a highly experienced veterinarian originally from Liverpool in UK with an expertise of 30 years of experience in the field. Karen is now based in Hilton Vet Centre. Karen brings a wealth of knowledge and expertise to her work, providing top-notch care for both animals and their owners. We are excited to have Karen return from season 2 to the Pawsome Companion to share her valuable insights with us today. Hello, Karen. How are you?
I'm good. And how are you?
Very well, thank you. I'm very excited to bring you back because there are so many things that we wanted to discuss, and we would love to obviously keep the conversation and start sharing tips and knowledge to pet lovers, pet owners, all around it. So we were talking about, like, a little bit behind the cameras about having like animals with parvoviruses or parvo.
Parvo, yes.
So what are the symptoms and how those symptoms can be prevented?
Yeah. Parvo is a disease caused by a virus that we see in dogs. It's called, the main signs are, it'll usually start with diarrhea. The dog may be off its food. The diarrhea, they may have a little bit of vomiting as well. But the diarrhea then progresses quite quickly, or can progress quite quickly, to what we call hemorrhagic diarrhea, which means there's a lot of blood in it. It's very bloody diarrhea.
Okay.
And it is very serious. Now, it's one of the diseases, luckily, that we can vaccinate against, but we do randomly have outbreaks, now and again in certain areas and throughout various years. And certainly, I think it was the end of last year, there was an outbreak, certainly up north and a little bit in the western suburbs as well. Now, the thing with the reason we get these little outbreaks, one, people either not vaccinated or forgetting to vaccinate, or, they can't for whatever reason, so the dogs are more prone to getting the disease. And the horrid thing about this virus is it can survive in soil for like 5 years.
Wow.
So it's a very hardy virus. And certainly that's where we tend to see that animals will pick it up as things like places where a lot of dogs go, so things like dog parks and things like that. So certainly, I personally would always recommend having your dog vaccinated. It does vary on the vaccines as to whether you need to do it yearly or even every 3 years. The vaccine I use is every 3 years, so we don't need to be vaccinating every year, which is good.
And this is the vaccine that you put to the dogs during the first 4 months?
Yeah, so we start them off as puppies, and then after that we sort of do it after the first year. We just do it every 3 years. But some of the vaccines you have to do every year. It depends on the make of the vaccine. But I would always recommend, all dogs getting vaccinated because the virus is so hardy and can hang around for a long time. And the nasty thing is dogs can die from this disease. And it's a really horrid death because so basically what the virus does is it strips out the inside of the guts, basically, and that's why it's bloody. It's because that's basically the inside of the guts just coming out the back end. And so they're very ill. It can be for a long time, and even if you get them through, they can have ongoing issues with what they can and can't eat because of it. But usually we tend to see it more in like younger dogs. And then very old dogs, because their immune system also doesn't work as well. So
there are some cases where the vaccines doesn't work, or
as with any vaccine, no vaccine is 100%.
Okay.
There's no vaccine out there that's 100%. So they're 95 to 99%, protective. But occasionally there are some dogs that don't respond properly to the vaccine, so that could still catch. They could still catch the disease. I said, or they just haven't had a vaccine for a long time, and so their immunity has waned. It's gone away. Their body no longer realizes it needs to fight that virus off. There seems to be more breeds. Certain breeds seem to be more prone to not responding to the vaccine as well.
Okay.
And it's not 100%, but certainly things like Rottweilers, Dobermans, German, used to like what we call our black and tan dogs.
Okay.
For some reason, they just don't seem to respond as well to the vaccine and are at more risk of getting parvo.
Oh,
so we always need to make sure we definitely have them vaccinated.
Yeah, and probably that's why we need our GPs, vets, to keep us
Remind
us what is coming, and also having like obviously all the story of the dog, of all the vaccines and things that have happened, so we know exactly when to do it and what is the next steps and all of that, which is great.
Yeah.
So recommendation for everyone will be like to do the vaccine and keep up to date with the dogs until the last day, right? Yeah. So, let's talk about on the cat side. Do they have to get this exact vaccine, or is a different one?
Cats is a little bit different. The one we always recommend is against cat flu and cat enteritis. Cat enteritis is similar to parvo, but it's a little bit different. Cat flu is probably the main one that we see, and a lot of rescue kittens or kittens that people have saved from because they've been dumped and things like that will have cat flu, unfortunately. Which is an upper respiratory infection. So they'll be sneezy, they'll be snotty, a bit like you and I when you've got a bad cold. But again, it can cause sort of ongoing issues with, sometimes they'll have sort of ongoing breathing issues, or they'll occasionally have bouts where they get a little bit snotty and things like that. So again, with cats, the flu one is the more important one. And that has to be done yearly in cats. The only time I'd say it doesn't is if they're purely indoor cats, they're less likely to catch it. But again, it's not as hardy as parvo. It won't last as long in the environment as parvo virus, the flu virus. But it will transfer on, like us. We could theoretically go and see a cat, get the virus on us, and take that back home to our own cat. Without realising. It will last long enough.
I was thinking that you were saying it will pass it to us.
No, we can carry it. We can carry it. We won't affect us or cause us any problems, but certainly the virus can be on our shoes, our clothes, and things like that.
In the same case for dogs, like if
we can carry. Yep, we can carry it. Yeah, so they're the two we have to be careful of. The big two. Yeah, but at the end of the day, if unsure or you're not sure what your animals are vaccinated against or what you think they should be vaccinated, speak to your vet. They can go through the options.
Is there any other illness that we as pet owners should take care of or are current in the veterinarian?
There's no real main ones at the moment that I'm seeing particularly. It's things come and go. They always, we always laugh in the veterinary thing that we see things in threes, certain disease, and we won't see one for ages, and then we'll have three of them all in a row for some reason. And that's just how it is. But there's nothing specific at the moment. So parvo has died down at the moment after that little escapade last year. But as I said, it could easily flare back up again. So always just be careful.
Yeah, absolutely. So regarding the discussion that we were having of side cameras, the dissects for animals.
Desexing,
Desexing for dogs and cats. So what is the ideal age for dogs? Let's start with dogs. They should have that sex.
It does vary. I always, and certainly at our clinic, we recommend a range of ages because it does vary. So legally, you're supposed to have all your dogs and cats desexed as part of the government here in South Australia. They recommend it should be done by 6 months.
6 months.
That doesn't mean you have to. At the end of the day, it is still a discussion and decision that you make with your vet. Now, as far as age in dogs, it does vary a lot. A lot of these larger breed dogs, so things from like your retrievers up to going higher, things like your Rottweilers, and then you've got your Great Danes and things like that. Skeletally, bone-wise, they don't mature until a lot later, till about the 12 to 18 month mark. And there have been sort of studies and thoughts that if we desex them very young, you're taking away those hormones that help finish off that
growing.
So the thought now is ideally, certainly I'll defer desexing for those larger dogs till Depends on the size, literally,
Yeah.
and the breed. It will be anywhere from 9 months to 18 months before I will recommend desexing them. Purely, it makes sure that they're fully grown, they're fully matured before we start taking things away from them. And that is really now the guidelines that we're looking at. You shouldn't be just blanket doing everything from at 6 months of age, because it's not how it works.
Yeah.
Each dog's different.
Yeah,
and it
absolutely.
is a personal thing as well. As I said, some clients want their animals desexed earlier because it's causing an issue, and that's okay. And other ones want to leave it longer because they're coping with it as it.
Yeah,
as
and so I'm like, one of the things for dogs, I don't know if this is true, but when they are not dissected, they wee everywhere.
Okay.
And right. And when you dissect them, they will stop that or no?
No.
Okay.
All right.
Some people have that belief.
They
so
do.
Let's please
clarify.
So
certainly male dogs will mark, so they will urinate more often.
Yes.
Because they're marking they've been there.
Absolutely.
Some may stop if you desex them, especially if you desex them sort of the 6 months period, but some don't. They will still do it anyway. My old boy, I desexed him when he was 18 months old because he was a big Malamute, so I left him till he was 18 months, and he still marked after he was desexed. It didn't change anything. That was it. But that's okay. That's a training I can help him, and go round. It's not the end of the world. And it's only when they were out on walks and stuff like that. So that it's desexing, it's this tying in with desexing and behaviour, which is not 100%. That's the thing. Desexing can help with certain behaviour. So it may help with things like male aggression, if it's hormonally based. It may help with things like that.
If they're aggressive dogs, may help.
It may help. But it's not guaranteed.
Okay.
And all these other behaviours, which people say, I don't want him, jumping. I don't want him, cocking his leg down every, street sign down the road. I can't. It may help a little bit, but it's not.
Yeah, because I have heard from
guaranteed.
people that is like, I need to dissect my dog to calm him down a little bit.
No,
but that's a no. Like it's not.
That's not going to change.
That's
some of them may be calmer afterwards, but it's because they've also grown. They're a bit older. They've just matured.
Yeah.
No, it's not the desexing that's calmed them down.
Yeah.
And there is a possibility. Again, there's the desexing and timing and what's linked with it. We don't really understand everything because even the studies that have been looked at. There was a big study a couple of years ago which looked at dogs that are between desexed and non-desexed dogs, and then compared what they had with diseases and behaviour and stuff. But the problem is it's what we call a retrospective study.
Yeah.
And there's lots of other variables like food, what training they'd had, had they been with other dogs on their own. So it's not easy to compare, definitely. But there is thoughts that desexing and not letting them mature, I said, certainly may lead to joint problems because that fits with the skeletal side of things and growing. And it may even make some dogs actually more anxious than less anxious because you've taken away the hormone side of things. So it's really got to be a discussion, a one-on-one with you as an owner, your dog, what you can do, what they're doing, and then what the vet can help you
and suggest
with,
as well
suggest,
in that time.
And it's not just, the thing is, there's also now we haven't got just surgical desexing as well. What we always did was what we called an ovary hysterectomy in the females, which is remove both ovaries and the uterus. We take all that away.
And what are the reasons
The reasons we do that when we desex them that way is the risk, the thoughts are that if you desex them, it reduces the risk of mammary tumours because you're taking away the hormones.
Yeah.
And as far as the uterus side of things, it was to stop something called a pyometra, which is an infection of the uterus, which they can get as they get older. So if you take it all away...
And they don't need it anymore,
and they don't need it, so it's fine. Now there's more talks of where we just take the ovaries away because it's a smaller, quicker surgery.
Yeah.
Or certainly a small, so a smaller wound. It's still complicated, but it's a smaller wound. You just take the ovaries away, so you stop the hormone side.
But that's only for female dogs.
Yes, that's for females. Now males, we take the testicles away. That's still the routine and the general way we do. We just take both testicles away. But as I said, there are more options now. There is chemical especially males, chemical castration, where we actually we can put an implant in that will lower their levels of hormones and stop that side of things.
But does it count like sex?
It still counts as desexed. Yeah, it does still count as desexed, but you have to do it. It lasts about a year, the implant. So you have to keep redoing it. So I don't tend to usually recommend it as a long-term thing, but sometimes it's good as a short-term, especially if they are having behavior issues and you want to see if desexing will help, or they have a medical condition that you want to see if desexing will help. You can put the implant in, see if it makes a difference. If it does, then yes, let's castrate them, get rid of both testicles. If it doesn't, we can still castrate them, but it's not going to solve the problem. We still need to put other things in place. So there are a few more options now available to us as opposed to just removing
but anyway, like there is no optional. If you have a pet, you have to register the pet as a breeder.
Yes.
If you don't, like says the dog. So it's not optional.
That's it. If it's not desexed, you on your council form, you are classed as a breeder, which I think they charge then. It's your fee, your dog license fee is higher than if it's desexed. We do with these bigger dogs as vets. If I've recommended that the dog is not desexed till it's 9 months or 12 months old because of my medical opinion, I can inform the council saying that I have deferred desexing for medical reason, and then they won't chase you or go any further until the date I have put, because I have to put a date in saying I have deferred desexing until they are 9 months. And then once they hit 9 months, the council will then go, you either need to register as a breeder or
So is this the case only for big dogs, or it could be for small ones?
Let's say an
example, Coco. Now I'm referring to my little Coco, which is mini, but
small dogs, they're mature by 6 months, most of them by Scalise. So they need to be done from 6 months. I'm sorry, you don't get away with that one.
I think it's more the scarcity of poor animal is gonna suffer. That's what keeps me.
The actual surgery, the usual day procedures. The animals come in the morning. They have a nice pre-med, which makes them nice and sleepy, helps relax, helps with pain. We then give them a full general anaesthetic, so they know nothing what's going on. We do the surgeries. I said they have pain relief as they're waking up. Everything's monitored. Everything is as safe as we can make it. And I don't want an animal to go home in pain, so I always make sure they've got lots of pain meds. And if they're quite jumpy animals, we'll give them stuff that'll help calm them for that period post-surgery as well, to give things a chance to heal and just help with everything overall. But for vets, it's a routine surgery. It doesn't mean it's not an easy surgery, but it's a routine surgery. It's one we do day in, day out, males and females. And we take every precaution to make it as safe as possible.
So in this case, at Hilton Vet, do you guys do that there, or you have?
We have our own surgical suite, so we will do the surgery, those sort of surgeries there. So they come in the morning, we do it that day, they go home that afternoon.
Okay.
Yeah.
You do it in the new.
Office. Now we've got now we're back in our old site. It's nice. Yes, it's all nice, brand new, and it's all nice and clean and good.
Amazing. So in terms of cats, the dissection part of it is quite similar or is different? Yeah,
the actual procedure is the same. We're removing the relevant bits. Cats, you can do really 6 months. You don't need to wait any longer in cats because all cats are fully grown by 6 months. So we don't there's no need to defer them or wait them any longer. And it does have more of an effect with cats, especially, and both male and females. But if you have a cat that goes outside, a undesexed male cat is more likely to roam. It is more likely to travel further because it'll be looking for a mate, especially at breeding times. And the female's the same. When she comes into season, she will be off, if she can, looking to get a mate and get mated. So
it's even more important for cats, otherwise definitely. They will leave home.
They will leave home, they don't care.
What a difference between cats and dogs in terms of, how they behave. Even if they are an indoor cat, they will just go.
Yeah, if they get the chance and they're not desexed, they will go, and it's that time of year and they're in season, male or female, they will try and get out and look.
Yeah, so this is the same period, 6 months, and then wait 7 or 18 months, or
cats 6 months. We'll do them all at 6 months of age.
Oh, okay.
I said they don't need to grow any bigger. They're fully grown by then.
Yeah.
They're like a small dog, so yeah.
Yeah.
Well, except they're not like a small dog, but size like they're like a small dog. But they're anything unlike, yeah.
But I have seen massive cats.
Oh yeah. You can get some, but they're nowhere near. It's like 6-7 kilos.
Yeah.
It's big cats, but even then 6 months is fine.
Absolutely. Is there anything else we need to know about cats that will be important for us to share with cat owners? Cats are
lovely, but they're they are independent creatures, and I think that's sort of a lot of the time people don't understand, but they like their own company and they like the company they like. They don't like change. I've owned cats myself. My mum always had cats when I was a kid. That's what I grew up with. But you only
have a dog at the moment.
At the moment, I don't have anything because all mine have passed. But up until then, I had dogs and cats always. Because why not? That's what I do. And as a kid, I said my mum had cats, so I was brought up with cats. That was who they were. But they don't like change. They don't like things being different than what they're used to. They get stressed very easily when things change. And they don't show stresses like dogs, so they're not going to sit there shaking or hide. The things they'll do, they may hide, but we'll quite often see they'll start urinating in weird places where they've never urinated before. They'll go on your couch or on your bath or in your bath and things like that. And that's them telling you they're not happy about something. Okay. That's their ways to say, I'm not happy about something. And then that can lead to, with cats, something we call feline lower urinary tract disorder, where they then get a similar thing to cystitis, where their bladder becomes inflamed, and then they need to go lots of times, and then you might see blood in the urine. But a lot of that is usually due to a behaviour issue. It's usually due because they're not happy about something. It's not an infection. It is purely because they're not happy about something. And that's how their body deals with the stress. It goes that way.
So in this case, that's fascinating to hear that. So let's say someone brings the cat to the veterinarian. You look at the cat and you are like, your cat's stressed. It's nothing else going on with that. So what are the sort of things that, obviously medicaments, but what sort of things I can do as a cat owner to understand that my dog is stressed about something in particular, and that I have to look at those
the things. First of all, usually the first thing I ask is, has anything changed in the house? I've known cats literally get stressed out at the fact that someone's got a new sofa. So it smells different and they're not happy about that. So it can be something as simple as that. Sometimes there's no change, or it may be that somebody else now is living in the house. It can be something like that. So the first thing I usually ask is, are there any changes at all?
Okay.
That may be the trigger, and then we just need to work around it. If there is a trigger, if it's something that can be dealt with, then we deal with that. But a lot of the time it's not. It'll be something like, a new sofa, a new carpet, new member of the household, which we can't get rid of.
Or a dog
coming in, or another cat coming in. That can trip them over the edge. So then it's a matter of trying to give them ways of dealing with their stress. So there's various medications. There's a lot of natural ones which are good. There's something called Feliway, which is a pheromone. That's the pheromone cats produce when they rub against you. It's their happy pheromone. So we can use that, but that's like a little spray or a little diffuser, which can help lower their anxiety, but it's nice and natural. There's also something you can add to the food, which is based on a milk protein that's produced in mammals' milk, which again helps lower the levels of anxiety. So you can add that to the food, again, nice and natural, which is what I usually try with first, because I don't want to be adding in medications if I don't have to. And then depending on what it is, giving the cat the ability to get away from, if it's like a new dog or in the house, giving the cat, they like to be above things. So giving them that option, having those trees or those climbing things so they can sit above things and get out of the way.
Okay.
Little hidey holes that they can go and hide in. again, to get out of the way of whatever is stressing them out so they can de-stress. But that's what they need. Sometimes if there's multiple cats in the household and another one's been added or whatever, something's upset the two of them, you might need to make sure you're feeding them separately in separate areas, again, to giving the cat the ability to space and escape. And that's a big one usually with cats, is just giving them that ability to be able to get away from whatever it is that's stressing them and keep from them. And then we can add in other medications if need. But that's where I usually start, is those nice natural ones, a few little changes in and around the house, and we'll go from there.
Yeah, okay. Yeah, that's important to know, because there are some things that it could be like behavioral things, or how they feel that is affecting like how they are in their normal habitat.
It can affect them.
So another question that I would love to ask you, that I have been asked a lot for our listeners, is, does the veterinarian suggest people or pet owners to have supplements for animals? Is that important?
With supplements, I recommend some supplements in certain cases. If they're fed a good quality diet, whatever sort it is, if it's a nutritionally complete diet, whether it's from a raw recipe or your bags off your shelf, they shouldn't need anything most of the time.
Yeah.
But I will use things depending on medical situations. There's a couple of supplements I will use a lot in a lot of older dogs if they have liver issues, because the liver's just not working quite as well as it used to because they've got a bit older. I will add in supplements then, because that can help the liver detoxify itself. So I'll use it there. Use it a lot for older dogs, again, in arthritis. Your fish oil supplements, your glucosamine, your chondroitin supplements in older dogs. Again, because it helps lubricate the joints a little bit, helps the inflammation keep under control a little bit, and can make them much happier without having to resort to the stronger meds straight away. So again, a lot of older dogs I'll have on a few different ones. I got
one quick question around that. So when you say an older dog, one of the things is like some people start giving them those supplements when they are sick already, when they are like suffering. So which age, if we talk from very young to old, should I start introducing those supplements to pets?
Again, it'll vary on the breed, because you've got to remember something like your little terriers are going to last well into their teens. Something like a Great Dane is only going to live 6 years. So there's a bit, you can't just pick an age. So what you want, it'll depend a little bit how they are, but those first few signs, certainly with something like arthritis, because most dogs are going to get arthritis as they get older in some shape or form. I will usually be looking to add in supplements probably from sort of that, what we call once they get into senior. So from about 7 to 8 years old for your average dog, so your Labradors, that sort of size. A big dog, I'm probably going to be adding it in 3 or 4 years old.
Okay.
Because they're not only going to live a couple more years, sort of scenario. And your smaller dogs, probably more to the 9, 10. So there's going to be a bit of a range. But I'm going to look at what their lifespan should be. And once we're sort of over half, so somewhere between half and the lifespan, I'm going to be saying, we probably need to be starting to add things in now to help your pet. Okay. So supplements, I'm looking to think, if you think about their lifespan, sort of halfway down and sort of a couple of years, 2-3 years on top of that, then I'll be looking at maybe adding in things like arthritis supplements, because they're going to get arthritis. And if I can give them something then, it's going to help them sooner. But sometimes I will add them in sooner. If a dog is known to have issues from a puppy with their joints, something like hip dysplasia, or even they had an injury, that caused damage to their joints, I'm going to add in supplements then. Once they've got over the surgery, if they've had surgery, or once they're mature, I'm going to start adding in supplements then to try and help them. Yeah. Because there's lots of supplements out there, and there are things that will help. So there's no reason
and
not
there
to
are
use them.
also, I have seen some of them that you put is when they have itchiness.
Yep.
And it helps with the digestion and all of that.
So I'll use prebiotics and probiotics as well with a lot of dogs, especially if they have sensitive stomachs, because that can just help settle the guts down and keep things under control. And with itchiness, again, you'd be looking at adding, you want supplements. There's specific skin ones, but the main thing in them is your omega-3s and omega-6 oils, because that helps with that coating of the skin to act as a barrier.
Okay.
To help soothe it and not make it not quite so itchy. So there's lots of supplements out there, but speak to your vet. They can remember which ones are good, because there's a lot of ones out there with no backing, and you can't guarantee what's in them. So speak to your vet and they can advise which ones.
Okay, this is great. Thank you, Karen, for all these incredible tips for all the pet lovers. We love to have you here, and hopefully in our next season we can have you back sharing more insights for our pet followers and listeners. Thank you so much for listening to us, and thank you.
Thank you.
Thank you so much for tuning into this episode of the Pawsome Companion. If you have any further questions for our experts, feel free to leave them in the show notes or reach out to me directly. And if you are a pet expert who would love to contribute to this podcast, we will be thrilled to hear from you. Don't forget to follow us, and if you enjoyed today's episode, we will really appreciate a 5-star review. Thanks again, and we will see you at the next episode.